Hi, my name is Dr. Demers, and I'm an integrative medicine physician. And today I wanted to tell you the story of how I went from being an internal medicine, a modern medicine doctor, to be an integrative medicine physician. So I started out, like all doctors start out, in my medical residency, my training. And that's primarily a hospital training. You're in the hospital with the sickest patients, so you see really the remarkable capacity of modern medicine to help people heal from things that should kill them. So that was marvelous, and I value that. And I also knew that I wasn't going to be a hospitalist. I wasn't going to spend my time with those sickest patients. I wanted to be a primary care doctor. So I started having clinic hours by the end of my residency. And that's really when my enthusiasm for modern medicine began to wane. I trained on the south side of Chicago, and the people I saw were poor and sick and many other things, undernourished, inadequate housing, all kinds of problems they had. And I saw that the pill that I was trained to give them for whatever the problem was wasn't really fixing much in their life. And that troubled me. And so I developed a practice of just loving them and listening to them and encouraging them along with whatever pill I had to offer them. But I saw that there was much more needed to really help people heal. And so I ventured out from there. Actually, I moved to Milwaukee because my best friend told me that I should meet her homeopath. At the time, I had no idea what homeopathy was, but she loved him, so I went to see what he did. And I basically thought he was a nut, but I couldn't dismiss him because in the day that I spent with him, he saw probably, 8 people, not very many in the modern medical system, but a few people that had serious conditions that were improving with whatever he was doing with them. I think one of them had Crohn's disease, one had asthma. These are things that don't heal in modern medicine. So he got my attention, and he invited me to apprentice with him. And in about 4 months, I called him back and said, "Can I still do that?" So I worked with him for about 2.5 years. And I learned a lot about not just homeopathy. I went to massage school. I studied nutrition. I studied yoga. I started meditating. I started studying herbal medicine and Ayurveda. And I felt like a whole new world opened up to me because these more ancient or more traditional systems of medicine have a whole different view of the person. And so that was exciting to me, that I could help people actually strengthen themselves so that they could tap into the wealth of healing power inside of them. That was exciting, as opposed to take your blood pressure medicine forever, which is the modern view. So that was exciting to me. And the more now I've been in this practice now for 23 years, and every day is fun. Every day I can be hopeful with people because I see them as having in them the spark of the divine. I see them as being made in God's image. So who am I to limit God? So when you come to me with your chronic problem and you've been told by your doctor it's not curable, or they're expecting you to have a progressive thing with this disease, it's going to progress, I get to say, well, maybe not. I get to give you a new paradigm of how else you could think about that. Because maybe you just need to do some cleansing, or maybe you need to balance your energies in a way, or there are other things that you could do that aren't Herculean that could actually move you into a healthier place, or champion your own healing power to move you into a healthier place. So it's true healing happening. It's not just palliation. And that's exciting for everybody. It re-empowers you as the patient to take charge of your health because you feel that you're doing it. You're healing. The pill's not doing it for you. You're actually manifesting better health because of your actions. And that's exciting for me to watch people adopt new habits, new possibilities, and see them progress in their health. So I love what I do, and I welcome you to join me in this world of integrative medicine.